Tend riwruog jochiw thieth pacho ka endi mano Kenya Union of Clinical Officers kod od thieth maduong' mar Ramogi Oginga Odinga Teaching and Referral Hospital ochuo koki ogirimiti mabiro konyo keto kenge mag bero ngima jochiw thieth kanyakla kod tego yore mag chiwo thieth e osiptandno. Millicent Adhiambo miyo ler.
Kane giloso e kinde chenro makamano mar chuo kogno mane otimore e osiptal ma Ramogi Oginga Odinga Teaching and Referral Hospital, jakom mar Kenya Union of Clinical Officers Peter Wachira oyango ni ogirimitino biro chiwo thuolo mongirore mar bero lwasi mar tich e kindgi kaka jochiw thieth kod osiptalno.
We are here to lay a foundation of social dialogue to ensure that we are in continuous talk and dialogue, that we complement JOTRH administration to ensure that our people can be able to offer the best services that we can in that aspiration of Vision 2030 and our Constitution, and also to be partners in ensuring that this facility rises above, because when that happens, then it is better not only for the people and for the administration, but also for the welfare of our people who are the clinical officers. As we move towards the year 2030, we have specialized facilities, specialized services to improve the quality, and so that we can be able to attract other people from other nations to come for medical tourism.
Jagoro maduong' mar KUCO George Gibore korka kore to ne okwayo piny owacho mondo okol chike matamo osiptande kaka ma Ramogi mano referral hospitals chiwo thieth ne jotuo maok rwak e wards kata outpatient services, kowacho ni chikno tuono osiptande go yudo gige thieth molony mowinjore gino mamono jotuo yudo thieth kaka dwarore.
When you come up and say you cannot see outpatient services, and that is the only facility within that proximity where it can see patients, what are you doing? You deny those facilities resources, and actually you make it so difficult for patients to access services. I think that one is something that we keep on calling for those who are leading in the SHAN, the Ministry of Health, that we need to reverse this thing.
Jatelo maduong' mar Ramogi Oginga Odinga Teaching and Referral Hospital, Dr. Joshua Clinton Okise, korka koreto ne oko ni ogirimiti makamano eno ndamo manyime madhi neno ni jochiw thieth ogoli orak kowuok e dweche 6 mondo gibed jotije mong'irore kata mondiki e yor permanent kaka yor miyogi arita motegno e yuto margi mondo ginyal dongore.
Our team, we have also developed something called job description analysis, and this job description analysis, this is what now we are going to use to do something called job evaluation. Out of job evaluation, the SRC will now further develop what's called salary advice structure to the facility. So we are going to use the salary advice structure to now convert our employees into now what we call parastatal payroll.
Millicent Adhiambo, Ramogi TV, Kisumu County.